All right, so today we're going to be discussing specifically dietary approaches to managing non-alcoholic fatty liver disease, and then we'll review a few things as we go to make sure that everybody is up to speed. So I guess the biggest thing is that a lot of individuals become quite overwhelmed with all of the weight loss diets, trying to elect which diet might be the best. And the truth is there is no superior diet, but we will talk about which ones seem to be most effective through data research for patients with fatty liver disease. So today we're going to specifically be discussing intermittent fasting, the Mediterranean diet, keto diet, low carbohydrate diets, specifically like traditional low carb diets, Atkins diets, Duken diets, and then calorie counting diets, which a lot of you are probably familiar with, which would be something like Weight Watchers or Jenny Craig, Nutrisystem, Noom, or there's a lot of apps for those of you who are on these digital platforms. It is very important that you understand that all diets, not limited to the ones that we're going to be discussing today or outlined within this series, are not appropriate for all persons or populations, and we'll try to be specific about who should consider which diet as we go through. But not every diet we discuss is right for every person. Keep that in mind. Okay, so does it matter? Does it matter which diet we choose or which dietary approach that we select? The answer is no. It does not matter which approach that you select. It ultimately, if you consume fewer calories than you expend each day, you're going to have the desired outcome of weight loss. So the goal would be something called calorie deficit. Calories in versus calories out. And you can expend calories in a number of ways. One of the most common ways would be exercise. There's different forms such as aerobic exercise or anaerobic exercise. So running, swimming, biking, that's aerobic. Anaerobic exercise would be things like weightlifting or resistance training, as long as you're not getting your heart rate up too fast. The goal of your caloric intake varies greatly among individuals. So please understand that this is not a blanket statement for women and men, but it does depend on your age, your metabolism, the level of physical activity, and many other things. But in general, women should consume roughly 1,500 to 2,000 calories a day, and men 2,000 to 2,500 calories a day. So a deficit from that baseline would achieve potential weight loss as long as there's energy expenditure as well. So the foundational goal is calorie deficit is the idea. But at the same time, we at the Fatty Liver Clinic are not asking individuals to stop eating to lose weight. We want to be able to institute a lifestyle change, one in which that's sustainable, which that's the hard thing. Many of us have had cyclical weight gain and weight loss throughout our lifetime. And part of that is because we've not really adopted a sustainable weight loss regimen or a dietary approach that we can sustain over time. So intermittent fasting, what is it? We hear a lot about it. It's really kind of trendy right now. And it does have its perks, it has its benefits, but it also has some drawbacks. So let's kind of talk about this foundation of intermittent fasting before we get into kind of if it's appropriate for you or not. So the food we eat, it's broken down by enzymes in our gut, okay, our digestive system, and eventually ends up as molecules in our bloodstream. So carbohydrates, particularly sugars or refined grains, those are quickly broken down into sugar, which our cells use for energy. That's kind of the process of how it works. So if our cells don't use all of that sugar or that energy, we store that sugar as fat, all right? So sugar can only enter the cells with insulin, right? So it requires insulin, a hormone made in the pancreas. So insulin brings sugar into fat cells and keeps it there. So insulin is definitely something that we have to consider when we're talking about dietary changes, or what underlying conditions might you have that make you insulin resistant. Maybe our type 2 diabetics, for example, or those that may not even create insulin in a way, such as a type 1 diabetic. So between meals, if we do not snack, our insulin levels go down, and our fat cells can then release the stored sugar to be used as energy. So we lose weight if we let our insulin levels go down. So anytime you have a caloric intake, specifically those of refined sugars, these types of calories are going to trigger insulin to move. Okay, so you're going to secrete insulin, and anytime that you do, you prevent your ability to lose weight. So that's why it's important that we make sure we have a period of time within this foundational understanding of intermittent fasting where you truly have no caloric exposure. because they believe that insulin level reduction allows you to consume or utilize the energy within the cells. So the entire idea of intermittent fasting is to allow the insulin level to go down far enough and for long enough that we burn off our fat. Okay. So, a lot of people in layman's terms like to say that intermittent kind of fasting is kind of allowing your body cells to realize that they need to use the energy that they already hold on to and not expect more energy to come, or that short-term starvation. So intermittent fasting has a multitude of different approaches, which can become confusing for patients. So let's kind of outline them in a very simple way. It doesn't have to be complicated. The idea here is that you're not going to eat for a period of time each day or each week, all right? So here is a few popular things that we kind of, popular approaches that we see. So alternate day fasting. So you eat a normal diet on one day and either completely fast or have one small meal less than 500 calories on the next day. Now, when we eat a normal diet, we obviously aren't wanting you to go and just rush off and eat a cake and cookies and ice cream, all day, every day, or eat what you want. Certainly, we would still suggest that you consume lean proteins like baked, grilled, or broiled chicken or fish with a multitude of colorful vegetables is the idea. Now, we do understand that certain health conditions prevent individuals from consuming green leafy vegetables, but within your own limitations, we do promote lean protein, non-deep fried lean protein, and vegetables that you can consume healthfully. There's also something called the 5-2 fasting. So you eat a normal diet 5 days a week and then fast 2 days a week. And those don't have to be back-to-back days. We actually discourage that, right? So you would want to have these fasting days separated by days of calorie consumption. You also aren't supposed to be consuming the additional calories to make up for the days that you lose those calories for that deficit. So you're not going to eat double on one day, then have a deficit the following day. Daily time restricted fasting is something else that we have to consider. This one is actually the most popular of them, actually has a lot of the data research showing success. So eat normally, but only within an 8-hour window each day. So for example, skip breakfast, but eat lunch around 11 and complete dinner by 7 p.m. For those of you who've come to our clinic, you've probably heard us say things like, don't consume any calorie after the hour of 7 p.m. Now, we also understand that not every person kind of has a normal sleep-wake cycle, meaning that you might work a third shift. So what you need to do is instead of these hours that you see plugged in here, you need to shift those hours that make sense for your normal sleep-wake cycle. So if you're up at night all night, then you'll have the 8-hour window of calorie consumption, but then you should not have anything to eat at least minimum 3 to 4 hours before you go to your overnight sleep or that window of sleep time. So that 7 to 9 hours of sleep, you shouldn't have anything to eat 3 to 4 hours prior to that. There is a circadian rhythm, which is something that humans naturally have. Basically, we have many hormones within our system that will allow us to kind of promote weight loss. And individuals who are up all night or don't get adequate rest, we know that these individuals tend to hang on to their weight a little bit more or promote weight gain. So we do encourage sleep. We do encourage adequate rest. Depending on your age, it's anywhere from 7 to 9 hours that are recommended. And then, of course, individuals who are working overnight in third shift, we do recommend that you try your hardest on days that you're not working overnight to sleep when it's dark outside. If not, have some sort of sunshine canceling curtains in your bed space or wherever you're sleeping so that your body is tricked into understanding that it might be nighttime because of melatonin rise and fall. Cortisol is the main hormone that promotes weight gain if it doesn't. So, should I try intermittent fasting? So it's safe for many, many people, but it's not for everyone. So for example, skipping meals is not appropriate if you're pregnant or breastfeeding. So intermittent fasting is not appropriate for those who are pregnant or breastfeeding. If you have insulin-dependent diabetes, a history of eating disorders, or under the age of 18 or other medical problems, it may not be a good choice for you. Okay, so you need to discuss this diet with your medical provider, one of us, independently based on your situation before starting intermittent fasting, okay? Or your primary doctor or someone else who can be able to help facilitate if this is good for you or not. So again, not for everyone. Breastfeeding, pregnant, definitely no. Insulin-dependent diabetes, eating disorder history, under the age of 18, or other medical problems, that may prevent you from not having that regular calorie consumption, this would not be a good diet for you. The Mediterranean diet. The Mediterranean diet is the diet that has shown the most statistical significant weight loss in fatty liver patients. So if we're going to promote one diet as being the most successful among our patients, data-driven, it would be the Mediterranean diet. So the Mediterranean diet is more of a lifestyle than a restrictive diet with food rules per se. Its goal is to incorporate the nutritious foods that people traditionally eat in areas surrounding the Mediterranean Sea. So it includes plenty of whole grains, fruits, vegetables, beans, and lentils, as well as seafood and healthy fats like olive oils and nuts. It includes a moderate amount of chicken and turkey, eggs, fermented dairy like yogurt, kefir, while limiting red meats, while limiting refined sugars that you see in sweets and processed foods. So the diet emphasizes the importance of cooking at home, enjoying meals with others, and fitting in regular exercise like walking. So the Mediterranean diet is much more than a traditional diet. As we had mentioned, it's a lifestyle, it's a way of living, one in which that can be sustainable if you adopt this. While we also recognize that these dietary changes can be expensive. Some people don't have the funds necessary to go out and purchase fresh chicken or fresh fish or some of these things. And the processed foods are generally the ones that seem to be the cheapest. You can buy a whole crate of ramen noodles for under $15, but that's a simple carbohydrate and it's a high sodium food. And so we ask that people really sit down and look at your finances in a way to prioritize things so that you can promote your own healthy living. So take a sit, look for the people within your family or your loved ones or whoever it is that you're sharing finances with. And then you should identify ways in which you can promote healthful living. So even if you can make an improvement and not a complete change, that's a step in the right direction based on your financial conditions. The benefit of a Mediterranean diet is that it decreases the risk of heart disease by, in part, lowering your low-density lipoprotein cholesterol or your bad cholesterol and reducing mortality from cardiovascular conditions. So we believe that there's a study called the Blue Zone study that identifies that the Mediterranean diet, actually in this part of the region of the world, does suggest that these individuals live longer. Their longevity is quite better than individuals in Western culture that don't follow this lifestyle. And the key point here is that it reduces cardiovascular risk because of the dietary exposure alone. So lowering low density lipoproteins or the bad cholesterol is one way in which these individuals do kind of have more longevity. Emerging evidence suggests the diet may offer protective effects for those with or at risk for type 2 diabetes, which means that they have fewer refined sugars, and it means that they have fewer refined carbohydrates within their diet, and it focuses on lean protein and vegetable intake. So it's been shown to have beneficial effects as compared with other diets and those with non-alcoholic fatty liver disease. So, things such as the keto diet is focusing on consumption of fats, and really kind of eliminate some of those energy-driven carbohydrates. But these are things that we definitely want to look at and promote within the Mediterranean diet. It has also been credited with a lower likelihood of certain cancers like breast cancers, and they're still trying to identify, but they believe it would be the estrogen receptor-dependent breast cancers that would benefit from a diet such as this because you're eliminating hormone-induced consumption of animal proteins. We also note that the Mediterranean diet, as I said before, focuses on healthy fats. So olive oil is the primary source of added fat in the Mediterranean diet. Olive oil provides monounsaturated fat, which lowers total cholesterol and LDL, or the low-density lipoprotein cholesterol, that bad cholesterol. Nuts and seeds also contain monounsaturated fats. So when you're looking at your labels, when you're in the grocery store, you can turn over, read it. If it says saturated fat or trans fat, those are the two that really promote kind of weight gain and bad fat increase. But poly and monounsaturated fats, these fats actually can help lower your LDL. These are the good fats, olive oil as an example. Fatty fish such as mackerel or herring, sardines, tuna, salmon, they're rich in omega-3 fatty acids. So these are polyunsaturated fats that help fight inflammation within the body. And we know that inflammation prolonged anywhere within the body. So to keep it relevant, people who develop fatty liver disease, that fat will cause liver cells to become inflamed and cause a non-alcoholic steato, which means fatty, hepatitis, or inflammation of the liver as a result of fat accumulation. So we know that polyunsaturated fats actually help reduce kind of global systemic inflammatory changes in the body, not just at the site of your liver, but throughout the whole body. So this is a positive with that diet. Omega-3 fatty acids also help decrease triglycerides. It reduces blood clotting risk and lowers the risk of stroke and heart failure. So there's a lot of benefits of healthy fats within this diet. So how do we get started? So build your meals around vegetables, beans, and whole grains. Okay, eat fish at least twice a week. Use olive oil instead of butter in preparing foods, and serve fresh fruits for dessert in place of like one of these high sweet refined sugar desserts that we all tend to really enjoy. Please understand also that fresh fruit should be limited in certain populations as well, such as those patients who are diabetic can only eat so much fruit, because we do understand too much fruit, too much of a good thing can be bad because it's full of what's called fructose, which is natural sugar. And your body doesn't process it a whole lot different. It still requires insulin, and it pushes that sugar into the cells, which then generates this fat store. So be careful not to overdo fresh fruit, and that would be a very limited portion of the diet. All right, I want to pause just to see if we have any questions on Mediterranean and intermittent fasting. Any questions from anyone who's tuning in? Just want to invite you to throw those in the chat. That's the best way to do it. I'll continue to go as you type your questions if you have. All right, the next on our agenda is to discuss the ketogenic diet, or the keto diet, as most of you have probably would call it. It's important to understand the difference between nutritional ketosis, or something we call NK in medicine, and diabetic ketoacidosis, or DKA, which we know that our type 1 diabetics and some of our type 2 diabetics may be familiar with DKA. So I want to make sure to educate the difference between these two before we really get into a ketogenic diet. So nutritional ketosis is when the body shifts to using fat instead of glucose or sugar for energy. So such as after a prolonged fast, right? The liver converts fat into ketones, which can be used by the brain for energy. So ketones are produced, but at a low level, and blood glucose levels are also low in people without diabetes. Okay, that's nutritional ketosis. Typically in diabetic ketoacidosis, this happens when blood glucose levels are elevated, usually greater than 250, with a lack of insulin. So ketone levels can be 20 times higher in DKA compared to the levels in that nutritional ketosis. So you're putting yourself through diet into a ketogenic state, similar to that of diabetic ketoacidosis, but at a level much less severe. So quite low ketosis and nutritional ketosis. With diabetic ketoacidosis, this is going to be up to 20 times higher, the levels in the NK. So diabetic ketoacidosis causes dehydration and electrolyte and acid imbalances within your blood. Usually your sodium and potassium become unbalanced or imbalanced. For those of you who are on the call who've experienced diabetic ketoacidosis, this probably brought you to the emergency department where they gave you a lot of fluids, probably a bag that's yellow in color because it's rich in potassium to replete your electrolytes. Diabetic ketoacidosis is a life-threatening situation, and it requires immediate medical attention, as I said. It's more common in people with type 1 diabetes, but it can also happen in people with type 2 diabetes. So please understand, when we talk about the ketogenic diet, we're discussing nutritional ketosis. We are not discussing diabetic ketoacidosis. One is mild sustainability, nutritional ketosis. The other one is a immediate medical attention, sometimes urgent versus emergent situation, usually in our diabetic population. So ketosis can be safe for people with type 2 diabetes, but ketoacidosis is not. That's the take home. So let's try to understand the foundational understanding of a ketogenic diet. So it's a high fat diet, moderate protein, and very low carbohydrate diet, okay? So you can understand how people who have non-alcoholic fatty liver disease, while this might promote someone to lose weight, we don't love the idea of high fat consumption in someone who already has a fatty exchange of their liver. So while you can successfully lose quite a bit of weight on a ketogenic diet, And the long-term effect of that can be beneficial. In the short term, this can certainly be harmful or kind of worsen your fatty liver disease. Around 75% of the daily calories are from fat. So 20% from protein and only 5% from carbohydrates. So as I had mentioned in the previous slide, where in nutritional ketosis, the liver converts fat into ketones. Basically, you're shifting that focus from using those carbohydrates as your source of energy to your fat as the source of energy. So the keto diet is not a high protein diet, which we like high protein diet. We like high lean protein diet for liver patients, especially individuals with cirrhosis. Some of you may have cirrhosis. So we focus on lean protein, right? Chicken, fish, turkey, baked, grilled, broiled, right? Not the red meats, not the high fatty meats. So when protein is digested, some amino acids, which are broken down proteins, right? When you kind of chew up proteins, your body starts breaking them down. Those proteins become amino acids. And amino acids can be converted to glucose. So too much protein can actually take you out of ketosis. So in this diet, it focuses on fat to keep you in ketosis, not too much protein, because you can convert those building blocks of proteins called amino acids to sugar, which can take you out of ketosis, which is what promotes your weight loss. Total carbohydrates are limited to 20 to 50 grams to induce ketosis. So they try to get you into this nutritional ketosis. Carbohydrates need to be spread throughout the day and not all consumed at one time. So typical foods on a keto diet includes lots of eggs, meats, poultry, seafood, oils, butter, avocado, olives, nuts, seeds, cheese, plain full fat Greek yogurt, cottage cheese, coconuts. As you see, things that are just high in fat. Now you say, well, Brad, these things don't appear to be that unhealthy. And I agree with you. It's just the percentage of how much you're consuming of this that can be dangerous for someone with fatty liver disease. So while it is a good diet to lose weight, we just have to be cautious if we have fatty liver disease. Carbohydrate intake should come from a non-starchy vegetable such as leafy greens, broccoli, cauliflower, peppers, asparagus, mushrooms, green beans. So higher carbohydrate foods like rice and pasta and bread and cereals, potatoes, and fruit are not included in this diet. There are many companies who kind of tout, that they have, they'll package you up a keto diet and mail it to you. And they do a good job, and they actually can send you quite a healthy option for keto diet. But most those come with a high price tag. Most people who try the keto diet, they're just looking for things high in fat, and they may eat loads of cheese. Well, if you have high triglycerides and high lipids and high cholesterol, and you're eating cheese on cheese, you can see here how not only would it be negative effects for your liver, also for your cardiovascular health as well. So be careful. You have to really be very choosy when you're choosing which diet to promote weight loss. The benefits of a keto diet, it has been associated with lower blood glucose, decreased insulin resistance, decreased hunger and cravings, promotion of weight loss, decrease in your triglycerides, and increase in high density lipoprotein. So your good cholesterol goes up, your triglycerides, which is free floating fat in your blood, will go down as long as you're choosing the healthy options for keto. Some of the drawbacks is one problem with the keto diet is that there are many versions of the diet, and this can lead some people to follow an unhealthy high-fat diet and not be in ketosis, so you have to be quite careful. We highly recommend individuals who are using this diet to work in conjunction with a dietitian or nutritionist to make sure that you're choosing the right foods. The keto diet may alter the gut microbiome. So what is that? So inside your intestines, it's basically a fight between good and bad bacteria. That's the gut biome that aids in digestion. And when you have a keto diet and stay in nutritional ketosis, the bad bacteria may then overtake, or it promotes an environment in which bad bacteria might overtake the good. So the diet is low in fiber, and it restricts some nutrient-dense foods, including whole grains, fruits, legumes, starchy vegetables. And there are, however, conflicting studies about the keto diet and gut health. So please understand that you are going to kind of log on to the internet and you're going to see both sides of the story. But data research does suggest that because of a low fiber diet and those foods that are nutrient dense have been eliminated from the diet, it can actually alter the gut biome in a way that doesn't promote your digestion. So you become nutritionally deficit in this type of diet if done inappropriately or too long. Again, there is conflicting studies out there, so please keep in mind that you'll see both sides of the coin when you research. The keto diet has been associated with an increase in low density lipoproteins, which may mean that this diet is not the best for someone who have high cholesterol, as I had said before. And due to a lower carbohydrate intake, people with diabetes may experience low blood sugar if they do not make appropriate changes to their diabetes medication. So individuals with diabetes starting a keto diet should actually do this under medical supervision so that you can have appropriate dose reduction of medication were it to be necessary in the absence of carbohydrates or reduction of carbohydrates. So again, we recommend speaking to your medical provider before starting a keto diet to determine if this dietary approach is a good fit for you, because we should analyze what chronic diseases that you might have. While our goal is weight loss, our goal is also to promote your global overall health. All right, low carbohydrate diets, okay? So keto is a type of low carbohydrate diet, but it was kind of unique with that kind of high fat. So we wanted to make sure that we were clear and kind of separated that one out. So low carbohydrate diets, when you reduce dietary carbohydrates, blood sugar and insulin levels generally go down, okay? And as I had said before at the beginning of this lecture, when you have a reduction in insulin or a reduced time frame in which insulin is surging, you actually promote the ability to lose weight. So low carbohydrate diets really kind of follow that main foundational insulin surge idea that when we reduce it, you can potentially lose weight. Carbohydrates are broken down into sugar or glucose, which raises your blood sugar and promotes your pancreas to produce insulin to drive sugar into your cells, as we said at the beginning. When you're overweight or when you're obese, your blood sugar goes up and your pancreas sends out insulin, but your cells may not respond, leading your pancreas to overproduce insulin. High insulin increases hunger and prompts fat storage. Okay, so insulin resistant. You may be producing it, but your cells are not responding to it, and it leads to an overproduction, which leads to high insulin levels. And then high insulin increases your hunger, makes you want to eat more, and prompts fat storage. Okay, so obesity and being overweight promotes you to gain more weight as you kind of lose resistance to insulin. A low carbohydrate diet may therefore help keep your blood sugar stable and keep your insulin levels low to potentially aid with weight loss. Because medical providers often recommend that those with type 2 diabetes lose weight to better their blood sugar, this approach could possibly directly and indirectly improve blood glucose levels. So weight loss is the cornerstone for a lot of kind of chronic health conditions, definitely for fatty liver disease. That is the only kind of proven mechanism at the moment to actually promote reversal of fat accumulation around the liver, or non-alcoholic fatty liver disease. So while there are a lot of studies that are being looked at and ways that medications that we can kind of make to help reduce fat around the liver and kind of reduce the potential of scarring around the liver, known as fibrosis, the best way to eliminate fat around the liver is a total body weight loss, 5 to 10%. 5% suggesting that you're kind of going to see a more naturalization of your liver chemistries and your biosynthetic function, depending on how well your liver works. And then 10% if we're going to have that low sustainability and basically kind of some reduction or even reversal of scarring at the side of your liver. So let's talk through some of the options. Traditional low carbohydrate diet, this approach includes 50 to 100 grams of carbohydrates per day. This is where many people start because it's less restrictive than a keto diet meal plan, but can still deliver results. Traditional low carb diets, remember, we are trying to promote something that's sustainable, a lifestyle change, similar to that of the Mediterranean diet, as we've discussed. A lot of people will have like a low carbohydrate diet for, I'm going to do this diet for 3 months, and they may or may not reach their goal, but then they will have cyclical weight gain or return of the weight if they don't continue it. So again, adopting something that is sustainable is quite important. All of these movie stars who kind of change or transition their body weight for different roles, a lot of them do these low carbohydrate induced diets because it has quick reaction, quick results, but they're not sustainable. An Atkins diet, this diet takes you through 4 phases, starting with very low carb consumption and then gradually introduces more carb rich foods throughout. It's good for people who like a more structured plan. So Atkins basically designed a 4-phased approach that allowed you to kind of have that quick result, calorie deficit from carbohydrates, but then also starts reintroducing them so that you can create some sort of sustainability. Less carbohydrates than you once initially may have consumed, but definitely more, or one that's a sustainable kind of cause through lifestyle change. So that's what Atkins promotes. Duken Diet also includes 4 stages. So 2 weight loss and 2 maintenance stages. So for instance, the first phase of the Duken Diet focuses on high protein foods. And the second adds in vegetables. And the third allows this 2 celebration meals per week. And then a fourth is about keeping your weight stable. So because you can follow the diet from the book, it also appeals to people who like that structured plan dietary weight loss. So those are 2 kind of more formal phased approaches for low carbohydrate diets that get you into a maintenance phase. So let's talk the specifics again about Atkins. We'll kind of move through those just so that you can understand. In phase 1 of the Atkins diet, this is a strict phase. So you cut out almost all of your carbs, eating only 20 grams of net carbs a day, mainly from vegetables. And for those of you who aren't familiar with the weight of foods, like 20 grams, for example, this is only like a palm size vegetable serving per day. Okay, so you can eat protein such as fish and shellfish, or poultry, or meat, or eggs and cheese at every meal. You don't need to restrict oils and fats, but you cannot have most fruits, any baked goods, any breads, pastas, grains, nuts, alcohol. You should drink 8 glasses of water a day, and you stay in this phase for 2 weeks, depending on your weight loss. So this is almost like a shock phase for people, right? They go from kind of doing what they want potentially, and now all of a sudden they're eating just a palm size of collard greens and a whole bunch of fat, okay, or protein. And it doesn't work for a lot of people, especially individuals who aren't used to restrictive diets, and especially those who aren't, participating in routine exercise. So routine exercise that is consuming some of the that is expending some of the calories they consume. So phase 2 is your balancing phase. So you do that shock or the introduction phase, you send it to a balancing phase. You can continue to eat a minimum of 15 grams of net carbs as foundation vegetables. You also continue to avoid foods with added sugar, and you can slowly add back in nutrient-rich carbs, such as more vegetables or berries, nuts or seeds, as you continue to lose weight. And you stay in that phase until you're 10 pounds from your goal weight. And each one's goal weight might be different. A good way to find your goal weight, of course, you can say, Brad, I want to be 280 to 80 pounds. That's my goal weight, right? But the way that we look at it is we just take 5 to 10%. We usually like to say 10% of your total body weight in reduction, right? So if you're 200 pounds, we want a 20-pound weight loss, right? So that's how you kind of establish a reasonable goal or to get us where we need to for your liver health, those with fatty liver. Phase 3 for Atkins is a pre-maintenance phase, and you continue to gradually increase the range of foods you can eat, including fruits, some of the starchy vegetables like sweet potatoes and whole grains. You can add about 10 grams of carbs to your diet each week, but you must cut back if your weight loss stops. Okay, so you stay in this phase until you reach your goal weight, and you have to play with that diet. It's almost learning how to drive a manual car. The clutch is a little bit unsure until you find your sweet spot. Find that sweet spot with what you can consume, and make sure that you reach your goal weight in phase 3. Phase 4 is the lifetime maintenance. So you move into this phase when you reach your goal weight, and then you continue this way of eating for the rest of your life. Here's where it's discouraging. Some people's pre-maintenance phase is very, very restrictive, and these are the individuals who just give up. And what you'll see is not only have they gained the weight back that they had lost, they tend to gain more weight back because they're mentally discouraged. So this is more than just a physical process, right? It's not easy. If it were easy, everyone would be, an epitome of health. It's not. And so what happens is we become discouraged. Life gets in the way. Western culture tells us that we should be busy, 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 no sleep, eat what we want, eat what we want. It's a social thing. Drink however much you want, alcohol. It's going against. It's basically you are a fish swimming against the current with weight loss. Just understand that it's just as much as a mental process as it is kind of that physical and decision-making, habitual and a day-to-day decision. And that's why we love the assistance of people like nutritionists and dietitians. People oftentimes will misuse a nutritionist and dietitian. What they do is, they assume that they're going to go in and they're going to tell them don't eat cookies and cake. Well, we all know that, right? We all know those things that we can't eat. how we should be treating nutritionists and dietitians is going into them and saying, this is my culture. Here's the foods that I enjoy eating. Here's the foods that I don't like. Here's the hours that I work. Here's the hours that I have to prepare food. What can we do to improve my dietary intake? That's how you treat a nutrition and dietitian. If you don't provide them parameters, they're going to tell you the idealistic diet every time, because there is an ideal diet for all humans. But we all know that ideal diet, right? Consume only water, right? Eat foods that are lean proteins and vegetables. Now, not all of us like that, right? Nothing on your vegetables, no butter, no nothing. So there is an idealistic diet, but it doesn't work for every person. So they need to know your culture, what food you like, what food you don't like, what your schedule's like, how much time you have dedicated to this. That way they can make a more sustainable plan or goal. So if you've met with the nutritionist and they told you not to eat cake, I would take some of that responsibility on yourself, call them back, make another appointment with those parameters and have that meaningful discussion so that it can be beneficial to you. Then we have to follow it. Unfortunately, we can't bring the nutritionist home. I wish I could. I wish I could bring them all home and they could cook for me or something, but that's not reality. We have to learn from the people who know how to do it well so that we can actually integrate this into our lives in a way that makes sense. Tell them your budget. I can't afford fresh broccoli every week. I can't afford fresh fish every month. Tell them what you can afford and let them try to help identify sources in which meet your lifestyle. So this is Atkins. A lot of us are familiar with it. Atkins had a really good approach. It's just we found that it's not over sustainable for a lot of the patients that we've worked. The Duken diet is a very similar approach. It's that 4-phased approach as I talked about. The first phase here is called the attack phase, which sounds a little more aggressive, right? Consists of pure protein and creates a kickstart the diet. So keto diet focuses on high fat, 75%. The Duken diet focuses on pure protein initially. Kickstarting that diet, during this phase, you can eat 68 high protein foods that produce immediate and noticeable weight loss. That's what they tout, okay? And this is true. We do see people who lose weight. Phase 2 is the cruise phase. You can add vegetables that will take you to your true weight. You will gradually but steadily lose weight by alternating pure protein days and protein plus vegetable days. And the average length of this phase is based on the schedule of 3 days for every pound you want to lose. So you stay in this cruise phase. So if you want to lose 10 pounds, it's a 30-day situation. Does that make sense? Okay. Phase 3 is the consolidation phase, right? And remember, phase 3 is where we lost a lot of our Atkins people. So the consolidation phase is designed to prevent the rebound effect by gradually returning previously eliminated foods in limiting quantities and allow up for 2 celebration meals per week. And this phase follows a strict timeline. So what they do is they're actually playing to your mental psyche by saying, if we give the individual on this diet a goal, right? Something they can celebrate or look forward to, their consistency and their compliance might be greater. So just like a lot of you guys are us guilty, we say, I'm going to make a New Year's resolution. And it's going to be, I'm going to lose weight. I'm going to eat right. I'm going to stop cigarettes. I'm going to minimize or eliminate alcohol consumption. And you are a rock star for about 4 days. And about day 5, you're doing whatever you were doing before. So while celebration days can be quite helpful, it will play with that mentition. We just have to make sure that we truly want it. So the question is, how bad do you want it, right? So no number of celebration days are going to motivate someone who's mentally not geared for doing this. So again, even though it's trying to kind of prevent the Atkins loss through the consolidation phase and the Duken diet with celebration days, it only works for people who are mentally engaged, okay? The other encouragement is that if the Duken diet works for you, you want to make sure that when you fall off the wagon, you don't just stay in the dirt, you get back up. So the days that you kind of celebrate without a celebration day, you don't have to stay down, just get back up, recognize that you weren't supposed to have done that on this diet, but can keep working hard, okay? Phase 4 is the stabilization phase, and this is the rest of your life. You have learned how to eat healthier and in the previous phases and have developed a pattern to follow. So both Atkins and Duken believe by phase 4, this should be a sustainable lifestyle, all right? That's the concept between those two. Again, please put questions in the chat. Feel free to send those over to Adrian and we'll make sure to get those answered. So Calorie counting diets, there is a lot of these, a lot of calorie counting diets that almost kind of makes us nervous which one to choose. And please don't go and sign up for 6 of them because they're all rooted in the same thing. Just find the one that you tend to like, maybe use the free trial for the 30 days, find the one that works best for you, and that's how you would select it, okay? Don't waste your money on all of these high dollar kind of calorie counting apps, for example. So the goal of calorie counting diet is to stay within a target number of calories each day. So these diets can help you manage your weight and your blood sugar levels. If you're overweight, lowering your number of calories you eat will actually help you lose weight. Remember, as we said at the beginning, calories in versus calories out. How much do you consume versus how much do you expend? This may also lower your risk of health problems like diabetes and high blood pressure because you're actually kind of really paying attention to what you're eating, maybe the sodium content for your high blood pressure, the carbohydrate or the sugar content for your diabetes. So foods, as you may or may not know, are broken down into groups. You can have a certain number of daily servings from each group. So in theory, this results in a balanced diet. So for example, like your protein group or your carbohydrate group, your vegetable or your fruit group, it also makes it easier to keep track of the calories in which you consume. Pretty helpful, you know, and the truth is even over the past 5 years, they've kind of developed technologies in a way that really make it quite simple. For those of you who've done calorie counting in the past before application services, and it was like this book that you would sit there and record all of these things, and that's quite tedious. And Western culture doesn't give you the time to do all of that because you're working and you're working hard and you have children and you have a spouse and or you may have 3 jobs, you may travel for work. So it wasn't conducive, but now it is a little bit more conducive to your lifestyle. It makes it quite simple. A balanced diet has a range of foods from each of the main food groups like grains, fruits, veggies, milk, meats, beans, and oils. Based on your calorie needs, a dietitian can help you find how many servings you can have from each of these groups. So again, tell them, I'm wanting to do this calorie counting app. I have it right here on my phone. I need you to help me understand how many servings from each food group I can have. That's what a dietitian does. He or she is the expert on making those things happen. I tend to really, really promote that profession and helping people with their weight loss journey because they know they can help you, but you have to be transparent with these individuals in order for it to work. Again, Weight Watchers, Jenny Craig, Nutrisystem, Noom, so many other apps. These are just a few examples of what you can do. As you know, these calorie counting diets continue to improve as time moves. As we have more and more research evidence on what the body's doing with calorie deficit, but here are just some examples of that. So developing new dietary habits is not often a simple task. Establishing a professional relationship with a nutritionist or dietitian can be very beneficial to your success. So in partnership with a nutritionist or dietitian, you'll be able to discuss targeted dietary goals and discover ways to achieve these goals. What's the difference between a nutritionist and a dietitian? We get that question often as clinicians. We use registered dietitians. These are individuals with a degree in dietetics, okay? These individuals are able to kind of dose calculate people who need tube feeds, dose calculate serving sizes for people with nutritional goals, such as weight loss or low sodium diets. So a dietitian is the higher order. A nutritionist, I could label myself as a nutritionist because I can give you good information about your nutrition. So be careful when someone touts as a nutritionist. Although we refer to our colleagues called dietitians or registered dietitians more frequent as nutritionists, all dietitians are nutritionists. Not all nutritionists are dietitians. So you want to make sure the person that you're visiting with is a registered dietitian, okay? Because these are the ones who have the medical know-how and prowess to be able to help you navigate medically what is best for your nutrition intake, okay? So even though we do like to call our RD, registered dietitian colleagues, nutritionists, they are, yes, nutritionists, but they more importantly are registered dietitians. Usually no less than a 4-year degree in most places. Again, the disclaimer, as we talked to at the beginning, it's important that you understand that all diets, not limited to those outlined in this educational series that we just did, are not appropriate for all persons or populations, and we recommend that you consult with your medical provider in selecting a diet that's best suited for you individually. The one that we talked about today that I want to highlight again is the Mediterranean diet. The Mediterranean diet is a lifestyle that we promote and has the most data evidence suggestive of success in patients with non-alcoholic fatty liver disease. So both NAFLD, non-alcoholic fatty liver disease, and NASH, non-alcoholic steatohepatitis. So if you have NAFLD or NASH, either one of them, the Mediterranean diet, data proof has shown to be most successful for long-term sustainable weight loss. Here's some resources, and we're here for questions. I want to say thank you to all of you for tuning in, and now I'd like to kind of give a moment for questions. Feel free to unmute your mic if that's easier for you, if you don't have the ability to type on your device, or feel free to type in the chat your question. We'll remain on the call for the next few minutes to entertain questions.
Hi, this is Jim Wells. Could you put those resources back up for me?
Yes, of course. Thanks for joining, Jim.